Hello and welcome to the highlights of our Euronews debate, asking how the EU can unlock the potential of sustainable healthcare. There's a lot to talk about.
As an example, the scrubs in the hospital, I wear a lot of single-use scrubs.
Disposable garments, syringes, there's so much stuff. It's about 30 kilograms of waste per bed per hospital on every day. Some of it toxic, most of it goes to incineration or landfill.
I think a lot of hospitals got rid also of their laundry facilities, and so this is now a problem for a lot of our members. They want to go back to reuse.
We all had the COVID crisis experience, and we have seen what a waste of materials.
These environmental responsibilities were a bit left behind.
Do you think healthcare is being overlooked in this conversation?
Yeah, I think often the healthcare sector is exempted from these measures. For instance, when it comes to the packaging and packaging waste directive revision, there was a provision on recycled content in packaging. So to have recycled content for food contact material in packaging, but the healthcare sector was exempted.
But the message is not don't touch, exempt healthcare, but the message is be careful, be mindful of the particularities of the healthcare sector and address it with care.
We think about what materials to use, how to design the machines in a modular way so that you can replace components, for instance. If you can just switch a detector unit, you have more uptime. We are digging up 100 gigatons raw materials every year from the Earth. Less than 10% of that is recycled. Tendency declining even. We need to find ways of providing healthcare services with less waste of materials.
Do patients care at all about the sustainability of the hospital? I'm guessing they mostly care about their health.
When they see these wrong practices or how much waste they are producing in the hospital, that makes them aware, oh, okay, this is so wasteful. But when it's the good practices, you don't see that much the outcome because there's not that much waste.
And appointing somebody at the European Commission who drives decarbonization and coordinates that in the healthcare sector specifically could have a huge effect.
Sarah, what are your thoughts on that?
That's an interesting idea. I love it, but I can clearly see some challenges.
We will make green public procurement criteria mandatory.
The joke in my house is that you only have had a proper visit to the doctor when you then go to the pharmacy with a load of paper and then you come away with a nice plastic bag full of drugs and then you feel like you've been properly treated. When is that going to change?
That's the reality in France. My reality is different. We started digitalization in Portugal since 2010. So at the moment, I just show them my electronic prescription and I receive the medicine.
Digitalization for sure will support the sustainability of the healthcare sector. It's important to emphasize that when you are making sustainability measure will not compromise the health of patients. It can actually bring also health outcomes. So I think that's important.
Patients are also consumers. They behave in a more and more ethical way, and this will impact the political level. We can be optimistic that at least circularity will remain a more perennial element of the next political cycles.
I think there's no future for healthcare if it does not become sustainable.
If healthcare can do it, what's the excuse for all other guys?
Thank you very much for being with us here on Euronews.